All right, another video update of my cancer treatment. My goal, as I said last video, was try to do one per week. And so this is Saturday. I started that one. I did that one last week. So several things have happened throughout this week, so I can update you. And first of all, I got a little cheat sheet here that I'm kind of to keep me on track, but I want to thank you first of all for all the prayers, the notes, phone calls, text messages, and the encouraging comments on both Facebook and on YouTube. Especially, of course, the prayer. I've had people contact me that I haven't heard from in years. In fact, I'll just give a little shout out to my neighbor, who's also a pastor in New Jersey, Sam Mountain. I hung around with Sam and Joe for years when I was a kid. They were my neighbors, and I appreciated the comment, or actually Facebook Messenger. I don't know how Sam watched the video because we weren't friends on Facebook up until now, but I was glad to hear from Sam Mountain, Pastor Sam Mountain. I think he's in Asbury, New Jersey, I believe. But it was great to haven't heard from him in years, and I haven't heard from his brother Joe. Maybe I can connect up with Joe somehow. I got a different hat on this week, and I wanted to make a comment about this hat. Last week I had a hat from Utah. I like to buy hats, different places that I go, kind of remind you of either people that were there, or that friends that lived there, or family, and a place you visited. So I wanted to buy a hat from Utah, and I think I mentioned last week, I really wanted something with a local flavor, but just didn't really find anything, so I bought a Utah Jazz hat. I liked the way it looked. But this is my, and I know everything's backwards on here, I think, for you. This is my Ron John Surf Shop hat. Probably a lot of you have been to Ron John Surf Shop. If you haven't, you've probably seen billboards for it. But actually, this hat was purchased in Michigan. Denise found it. It was like a brand new hat. She found it at a yard sale. And I've had another hat from Ron John Surf Shop. I've had other hats from Cocoa Beach or from the Merritt Island area, but those mean a lot to me because my parents retired to Merritt Island, and my brother Gary, who has passed away when he was about 50, he lived in Merritt Island. So when I see hats that have anything to do with Cocoa Beach, Merritt Island, Cape Canaveral, Kennedy Space Center, if I have any of those, that reminds me of some people that I love that are now in heaven. So that's good to have. That's why I'm wearing this hat today, sort of a dedication to Mom and Dad and Gary. I wanted to discuss tests and procedures that I've had so far, and then what I'll have this week. And I mentioned before, trying to keep these videos relatively short. So tests and procedures that I had so far. This started with an annual physical for our foster care and adoption, and that's when the doctor found a small lump on my neck. Now it's probably the size of, if you put two golf balls side by side, that's about the size, the height and diameter of it. At least that's the way it feels. Maybe a little smaller than that. So it started with that annual physical when the doctor found that lump, and the first thing he recommended, let's just treat it like an infection. He gave me he gave me antibiotic, and then he scheduled an ultrasound, and then from the ultrasound we went to a CAT scan maybe a week later, and from the CAT scan it was pretty clear that this looked like lymphoma. So then he scheduled a biopsy and a PET scan about maybe a week or two later than the CAT scan. We had it scheduled. And the biopsy confirmed that it was diffuse large B-cell non-Hodgkin's lymphoma. PET scan told them where else it was in my body. It's in areas of my diaphragm. Your lymph system is throughout your body. It's spread to the areas of my diaphragm and then down in my groin. And then met with an oncologist, and the oncologist recommended, I didn't have to, I could be jabbed every time I went in intravenously through my arm, but the doctor recommended me having a port put in. So Friday, I had a port put in. Honestly, I thought the port was going to be like a tube hanging out of your body, but it's actually something they put underneath your skin, and then that's sort of like a landing pad that they poke every time you go in to have chemotherapy. They can do your blood draws from that. So I wanted something like that. Plus, it's a bit safer because you're putting toxic chemicals into your body that are intended to go into your veins, not into other parts of your body, and they can actually cause burns or stuff like that. So I also wanted to talk about medications too. So Tuesday is going to be my first what they call RCHOP chemotherapy treatment. And I wanted to tell you what RCHOP is. And there's a lot of other places you can go with people, doctors, and medical experts that are far more knowledgeable than I am. And I think it's the Leukemia and Lymphoma Foundation has a lot of information. There's a lot of videos on YouTube that if you're interested, or if you know someone else that has this, that you can watch those videos. So what is RCHOP? It's an immunochemotherapy regimen used to treat both indolent, which is passive or lazy cancer, and aggressive forms of non-Hodgkin's lymphoma. So here's the 5 chemicals, and that's where they get that acronym RCHOP. The R is rituximab, and this is an antibody that actually attacks antigens on your B cells. And that, my understanding, this first therapy, that's the only thing that I'll be receiving is the rituximab, if I'm pronouncing these right. The next one is, I'm going to try to pronounce this, cytophosphamide. And that's actually a derivative of a chemical that was used in World War I called mustard gas. And by the 1940s, they realized it could be used to lower the white blood cell count, which it drives down the white blood cell count, which fights off the cancer. And then the next one is doxorubicin, and then it has hydrochloride, which is where they get the H, so RCHOP. And that's actually comes from a streptomyces bacteria, and it's basically like a microorganism that destroys cancer cells. And then the fourth one, let's see, 1, 2, 3, 4, is called vincristine, which a brand name of it was Oncovin, which is where they get the O and RCHOP, so they can make an acronym. And that actually is interesting. It comes from a flower, a Madagascar periwinkle, that somehow they figured out that the derivative of that flower actually fights cancer somehow. And then the last one, which is taken orally 5 days on the day of the treatment and 4 days after, I take high dosages of prednisone, which is a natural released hormone in your body, but I'm going to be taking in a high dosage. It's an anti-inflammatory. And actually, just for an example, Denise had a really bad case of poison ivy all over her arms, and it was really bad. So the doctor prescribed prednisone to help fight off that poison ivy. I'm not exactly sure how it works, but that's what it does. So somehow it helps calm down the reaction of the white blood cells. So, and then the other thing is side effects. Now, as you could hear, these are toxic chemicals that they're putting into my body. And you know people that have had cancer, chemotherapy treatment, and other treatments, and there are side effects. There's a war zone, basically, inside your body now. And there is all the time. But this is a war with these chemicals they're putting in to fight the cancer cells, and your body's reacting to those chemicals, and they attack other things in your body that you really don't want to attack, but they have to. Sort of the adage I thought of is you gotta expect a few casualties if you're going to take the hill, and that's what's happening. And so I always have said that I would never be one of those people that would have a shelf full of prescription drugs. I'm just going to be too healthy for that. And it's kind of interesting when I have gone to the hospital and they've asked me, about surgeries, and I've never had any surgeries. I've never been, seriously ill. I spent one night in the hospital, and that was to have my wisdom teeth removed when I was a junior in high school. Back then, you spent a night in the hospital. Now you just go home. There's so many things that they do today that are considered outpatient surgery that back in the day you spent time in the hospital for. But God has blessed me with really good health, And you take that for granted. And I'm thinking, okay, I'll never be one of those people that has a shelf full of medication. Well, look I'm on my way. I got 4 medications now, none of which I have to take yet. But most of them, or not most of these, are actually to try to combat the side effects from the chemotherapy. So you're sort of putting these chemicals in to try to do the good things, but fight the bad things, I guess I would say. So what are some of the side effects? And the big ones are a risk of infection, because you're lowering your immune system. You're putting a hammer on your immune system. So you have to be careful with that. And then nausea, of course, you've always heard about that. And then hair loss. And that was like one of the ones that comes up with every single one of those, well, at least 4 of the chemo drugs that are going in, hair loss. So I expect to lose my hair. And then fatigue. And there's a lot of other possible side effects, some probable, but they give you all the possibilities of the different types of side effects. So anyway, I'm going to leave that there. I hope this maybe better informs you of how you can pray. Appreciate your prayers on Tuesday. That'll be the day that I get the first treatment. And I've talked to so many other people. I shouldn't say so many other people. I've talked to other people that I didn't even know had cancer, and they told me about their treatment, and they've gone through chemotherapy, and they've told me about the side effects and what they went through. So I really appreciate, others that kind of can tell me what to expect. So this video is already going a little longer than I wanted it to, and I probably went through some things fairly fast, maybe included too much. I have a kind of write myself notes of other things that I want to do a video on, or at least mention in a video down the road. So I'll try to include those things. But so I hope this helps. Hope this informs you maybe to pray in how you can pray, and I appreciate again the encouragement, and I'm so thankful for the Lord, for the Christian brothers and sisters and my family and friends that are just such an encouragement through this. I've gotten so many encouraging comments, notes, just face to face when I meet up with someone, just to let me know. So I really appreciate it, and I'm going to leave this here, and you'll hear from me at least by next Saturday, maybe even sooner than that. And thank you again, and God bless you folks, and I'll see you next time.